I'm going to ask all of you to attend CES so you can teach everyone how a room gets quiet. That was incredible. So, good morning, and welcome to the Digital Health Summer Summit. As you may know, this is our first Summer Summit, a sort of first cousin to our bigger sister, Digital Health Summit at CES in Las Vegas. But all you have to do is look around the room to see this is a very, indeed, a different kind of event. First, we've designed this summit to be intimate. Well, as intimate as 170 people can be. But it's been put together to make the most of your time here, to network, share, and connect. And yes, those are all synonyms for talking. We want you to get to know each other, get to know our presenters, get to know our Expo exhibitors, and talk until you can't talk anymore. Seriously, it's this personal connection and the inspiration and camaraderie at an up-close and personal event like this that gives birth to the best ideas and most rewarding collaborations. You'll see. Second, as you found when you registered, the topics of our sessions are not what you'll find at the typical technology healthcare conference. Yes, we're going to discuss some breakthrough products and services that are using digital genius to reinvent our healthcare system and personal health management. But more importantly, the lion's share of our time will be spent talking about business, your business, and the myriad of issues you need to consider to truly succeed in this rapidly evolving space. What goes into good design of a consumer product? How do physicians and medical systems go about adopting and buying new technologies? How do legal and regulatory fit into the picture? How do you raise capital? And how do you generate revenue, especially from bigger customers like hospitals, health systems, and even the government? And that's just scratching the surface. But don't worry, we have your back. As you'll quickly see in our keynotes and our presentations, your time will be well spent. We've assembled a group of diverse and deeply knowledgeable experts from a variety of backgrounds to help you chart your next steps in digital health. They come from research, insurance companies, hospitals, startups, the media, academia, mobile, and more. They come from research, apologies. In fact, we have participants all the way from Moscow and London. Are the people from Moscow and London here? I'd love to give you applause for flying all this way. So ask questions, lots of questions, and prepare to take a lot of notes. We have a big notebook for you, as you can see. We could easily spend an entire day on each one of these topics, but we hope that this will open the door to start answering some burning questions you might have, as well as drawing your attention to things you haven't even thought about. Aside from advancement of the industry, one thing is top of mind when we craft this type of event, helping you make the most of your investment. Depending on your unique situation, it might be your investment of time and your research into a new technology platform, or it could be your investment of money in a business that's set to redefine how people get and share medical information. Whatever your reason for being here, we're confident that the relationships you build and the knowledge you'll gather here will help you make the most of that great idea you've been nurturing. Personally, I love these gatherings because I love entrepreneurs. There's nothing like meeting someone with that spark that you know will grow into a transformative technology. And a real treat for me at this summit will be meeting the emerging entrepreneurs from Rock Health. You want to see the newest and brightest minds in digital health have to offer? Well, they'll be here. Well, having just graduated from one of the hottest incubators in the industry. Yesterday was their big graduation day. They're on the plane right now. And their ideas and determination will inspire all of us. So get ready, sharpen your pencils, or charge your iPads, or whatever you need to do, because we're on our way. Enjoy the intensity and the learning you'll experience over the next 2 days. Oh yes, and do not forget to have some fun. So before I introduce our keynotes, a few things. First, I want to introduce you to some very, very important people. I want you to meet, and if Robin and Linda can stand up, Linda NASM and Robin Raskin.
She's standing up, just in a different...
Okay, back over there. The owners of Living in Digital Times, and my partners in crime in putting together this whole event. Their dedication to technology and healthcare is passionate, deep-rooted, and boundless. Second, if we could just switch to the next slide. To the sponsor slide, please. Second, I want to extend a major thank you to our partners and sponsors. They trusted us on this new venture, and we so appreciate their collaboration and partnership. First, thank you to Qualcomm Life, who joins us as co-hosts of this entire summit, as well as our platinum sponsor, United Health Group, gold sponsors, Good Shine, ShareCare, and our strategic sponsors, the Consumer Electronics Association, Frost & Sullivan, and Rock Health. And now for just a couple bits of housekeeping before we move on. No seats are reserved here, so I encourage you to change tables between sessions or on the breaks, and take the opportunity to meet and mingle and see who else is shown up. I saw the list and it's quite impressive. There's a little sign on your table to remind you of our Twitter hashtag, RX for Digital Health, so tweet to your heart's desire. I also want to extend a real special thank you to Misfit Wearables. Misfit designed our first Digital Health Summit application, which is available on the Google Play Store. Is that what it's called? Sorry. And so that's the Android version, and it's also available in the Apple Store. We have a video crew here that's going to be wandering around, so if they pull you aside and ask you some questions, please take your 15 minutes. And last but definitely not least, in your front pocket you will find a card entitled The RX for Success. Do not throw this away. Please take the time to meet with all of our exhibitors on scheduled breaks and get at least 6 of them to stamp this card. Please drop that card at our registration desk, and tomorrow you'll be entered to win an Eli Manning 2012 signed Super Bowl football. So it's kind of a cool gift, I think. Maybe for the men. Now on to the good stuff. Okay, I'd like to introduce you to our morning keynote. Dr. Michael Clark. Dr. Clark is currently the Chief Science Officer for ShareCare and the Chief Executive Officer of the National Academy of Sports Medicine. He was named Health and Fitness Visionary of the Year by Men's Health magazine. He's also the creator of NASM's exclusive Optimum Performance Training model, which is used by health and fitness professionals with millions of clients worldwide. I'd like to welcome him to the stage.
All right, good morning, everyone. We're excited to be here today. Before I get started, I want to share, we had 3 kind of unique experiences in engaging our platform this week that were totally different. One, we met with one of the largest restaurant chains in the U.S. that wants to engage our platform to bring physical education and nutrition to over 100,000 schools and engage teachers and parents, so that was an interesting one. And then our partner, National Academy of Sports Medicine, who certifies and educates about 30,000 personal trainers per year, they're engaging our platform to create a classroom in the cloud and to create an engaging membership platform to ultimately connect personal trainers directly to consumers and hopefully improve their health outcomes. And then a third one is a client of mine who uses the ShareCare platform as well as a professional baseball player who on Wednesday, I believe it was Wednesday, maybe it was Tuesday, hit a grand slam that tied him for first place in history of baseball. So all of those different challenges and environments use our platform, so it's pretty fun to see all the differences. I'm going to do 2 things today. One, I'm going to give the overview of what ShareCare is, and then I'm going to go into one of the divisions in ShareCare and talk about ShareCare Fitness and how that can fit into hopefully improving the overall health outcomes and health results of all consumers that are seeking health information online. So the first part is to just review and give an overview of what ShareCare is, the main platform. So ShareCare was founded by Jeff Arnold, and for those of you who don't know, he founded WebMD. Later, he owned a company called How Stuff Works that was then sold on to Discovery. And then while he was at Discovery, they wanted to create Web 3.0, which is what they really called a socially connected environment that could improve health outcomes by using personalization tools and connecting consumers directly to providers that can help them with their challenges. So he partnered up with Dr. Oz and Harpo and Discovery, and they created this incredible platform. And ultimately, the mission of this platform is to measurably change health. And to do that is to create a collective IQ of health and digitally activating the top brands in the planet. And often we call ourselves the humble host because it's really not our voice. We're trying to bring the best voices together. So aggregating, organizing, and disseminating that information directly to consumers that are looking for health. So when you start to look at ShareCare, our model is bringing targeted information direct to consumers. So if you look at consumers looking at a long tail search, they type in a very specific question that might be 5 to 7 words long. So they're looking for very specific targeted information. So our system is designed for that. So we've taken our digital partners, activated their content, break that down into Q&A, and then when a consumer types in a specific question, they get a specific answer. And they get this answer from a perspective of potentially a hospital group, a major organization, a top thought leader. So they get the perspective and they get to choose how they want to consume health. And so we have over 1 million pieces of health content from A to Z, basically, in 48 different nodes. And we've, with all of our partners, which I'll go through in a moment, we have access to over 2.5 million professionals. And with the reach of these partners, it's over 75% of the US population. And on the first slide, I didn't mention, but we have right now, we just started in 2010, really in 2011 when we kicked off. And right now we have about 20 million unique users with about 120 million page views across our platforms and growing very rapidly. So oftentimes we'll call ourselves a social health network. So ultimately what we want to do is use our media partners to become a media driver, and then we want to socially connect our environment both with their peer groups but then also ultimately to professionals. We've recently acquired the Little Blue Book, which has 430,000 physicians in it, and it's the yellow pages for physicians. And so our goal is to digitally activate these physicians and give consumers direct access to these experts and ultimately locally drive them into their offices. So that's a very engaging opportunity for us. In 2012, we've activated 1.5 million consumers through our challenges, which I'll talk about in a moment. And again, for us, it's not providing the information. That's the top level of what we're trying to do. It's really engaging them down to take action with the personalization tools we have and then connecting to pros. So our strategy that we talk about, it's an inverted triangle. And the top of that is the information layer. So that's somebody coming in, asking a question, and we give them the information, again, targeted, but ultimately then connecting them directly down into personalization tools that are specific to what their needs are, and then driving that down into support with the appropriate professional, whether it's a physician, a nurse, a chiropractor, a physical therapist, a personal trainer, an RD. So it's the funnel of engagement that we're trying to accomplish. So what we did to get to the information level, I'll go through each of these 3 strategic layers. The first layer for information, to go out and get the best information, we pursued the top thought leaders that are out there, and our goal was to digitally activate their content, whether they have books, whether they have other web content, and so converting that into Q&A and make it very specific and very targeted. We then went after the top hospital groups, and same thing, we took all of their amazing information that they have and put it in a very entertaining format, but very targeted, again, in the Q&A strategy. We're continuing to add hospital groups across the country. We then went after all the top brands and the top organizations, and we have around 175 total partnerships now, and we've accumulated or aggregated all the top not-for-profits, including American Heart Association, American Cancer Society, all of these different groups. We then went after brands that are very relevant in the space, that are trusted. So whether it's skincare, or weight loss, or pharma. And again, the goal is not to have just paid advertisement. These are knowledge partners that interact with our clients through this Q&A, through this personalization tool, all the way to support strategy. So when consumers come in and ask a question, they get the answer from all these different perspectives. A not-for-profit, a hospital group, a thought leader, and then these individual brands. So it's a really incredible opportunity for consumers to ultimately create their own wellness team and get to choose their experience based on what reflects their interests and their goals. The next layer of our strategy is action. So that was the information layer. The second layer is the action, and this is really what's important to us. This is the beginning of what we think makes ShareCare unique. So we know that all these apps are coming out. We know right now 70+% are for consumers, 25 to 30% are for professionals. That number is supposed to triple by 2013. Upwards of 500 million people will be using mobile apps for health. So the numbers are staggering, but I think for us, what we want to do, more is not better, better is better. So we want to make sure that what's getting built reflects evidence-based methodology, reflects the ability for a consumer to actually use it and get results, and then ultimately connect to somebody who can help them. And so that's really ultimately our goal in this space. So we partnered with the American Red Cross, Dr. Oz, and Google, we created a CPR app. And through our social media efforts and through our campaigns on ShareCare, we were able to get 125,000 downloads of this app. They did it on their own, and I believe they got 500 or 700 downloads. And then by using the ShareCare infrastructure and the voice within, they're able to get this kind of number. So it's a really good way to create activation. We also launched several challenges. The first challenge we launched was in 2011. It was called the Move It and Lose It Challenge. It was in partnership with Nike and the National Academy of Sports Medicine. And through this campaign, it was an 11-week weight loss challenge. And it was delivered off of Dr. Oz. And we activated around 1 million plus people. And we had 500 certified personal trainers that interacted with these consumers. So we had weekly webinars where consumers could ask questions live and we would answer those live. So we had the perspective of doctors, registered dietitians, as well as personal trainers. And then we had weekly tips that came out with exercise, nutrition, behavior modification. And then we had a specific personalization tool where you can create your own exercise plan, you can create your own nutrition plan. It has an interactive calendar, and it has the ability then for you to, whatever you're doing, however you want to be physically active, to implement and log your activity, log your food. If you have biometric devices, you can upload those. So it was a really engaging process, and it was very, very fun. This group called themselves the ASMs, which was about 2,500 individuals who created a small kind of social network within the program. And they eventually started creating their own running clubs where they would meet in different cities and do 5Ks together. So this was a pretty amazing, not only did they lose weight on the program, but they then created their own social networks through Facebook and Twitter, and then they met live. So it was a pretty incredible opportunity. After that, we were approached by the first lady, and with the PALA campaign through Let's Move, and their goal was to get 1 million individuals to earn this award. And in May, they had about 17,000 individuals. We got involved with them in July, and we ran the campaign through September. We used social media. We used a lot of our celebrities and athletes that we have access to, and we were able to help them get over that 1 million hump. So again, another very engaging campaign that used our entire strategy. We then followed up with a program called Transformation Nation. And in Transformation Nation, this was created, one of my colleagues is here, is Rich Benchy. He's the previous president of Real Age. So later, if he's around, you can talk with him, but he helped create this campaign. And this was delivered directly from Dr. Oz from the season 3 from September all the way to May. And it was $1 million challenge. And ultimately, we got 1.3 million participants in this program. Almost 1 million, 986,000 took our ultimate health quiz, so we have a tremendous amount of data. 260,000, actually Rich was telling me before, more than that, actually physically went into Weight Watchers and weighed in. And then from that campaign, the average weight loss was 10 pounds. And then if somebody did all 7 steps, the average weight loss was 24 pounds. So again, incredibly engaging. And recently somebody just won the $1 million check. So just showing the process of how we're going to continue these challenges using different forms of media, different partners, and again, to create measurable change. And then the third layer of our strategy, so we talked about information with all of our partners, action with our challenges and our tools, now into the support. Ultimately, what we want to do is we want to connect consumers with professionals to ultimately help them close the gap and get the information they need, get the tools they need, and get the care they need. Because we know the care is delivered locally, and so we want to connect consumers with local practitioners who can help them actually accomplish their goal, and then leverage the digital platforms to stay connected 24/7. And so we're doing many things with physicians, as I mentioned before. We purchased the Little Blue Book, so we're digitally activating these physicians. Physicians can then have an advanced page, kind of a physician plus page, so to speak. And from this, consumers and their zip code can find whether it's an orthopedic surgeon, a chiropractor, whomever it might be, a dentist, an eye doctor, and then from there you can actually schedule directly with your physician. And then you can use this platform to stay connected 24/7. And we have a lot of other components that we're adding into this model. Several companies we're acquiring right now that will fit into this as well, which will continue to drive this overall results and health outcomes. So this is bringing me now, so that was a quick overview of ShareCare. And think of it as, again, a social health network that is trying to digitally activate the top brands, the top thought leaders, the top hospitals, the top subject matter experts, and then bring the tools so consumers can take action and then directly to support. And again, on the support side, we have a partnership with the Academy of Nutrition and Dietetics, so there's 75,000 RDs. We have a partnership with the American Chiropractic Association, there's 75,000 chiropractors. With the National Academy of Sports Medicine, with access to over 100,000 personal trainers. So again, we have all of these abilities to educate and engage the pro, and then ultimately connect the professional to the consumer. And then on the same side with the consumer is to inspire them to come to the site and then get connected to our pros. And so now inside of ShareCare, we created a very specific division called ShareCare Fitness to ultimately try to deal with this epidemic of overweightness and obesity. And so on our site, with over 20 million uniques, we're seeing 70% plus that are searching for weight loss, fitness, anything kind of in that category. And so we wanted to really focus on this because if you look at the numbers, we have this amazing innovation, amazing technology, 80% of consumers looking for health online, but yet in a decade, we haven't made any change ultimately in the health outcome. If anything, it's gotten worse. And so in 2000, it cost about $5,700 to insure a family. And in 2010, that number went up to $13,500. And by 2030, it's expected to go up to $25,000 to insure a family. And so if we don't get this under control and get real outcomes, then obviously all this technology, all this innovation is not doing anything. So we have to figure out a way to get out real outcomes. So when we start breaking this down a little bit more, 190 million potential consumers that are looking for all of our stuff in this room. And the challenge or the problem, it's overeating, eating the wrong things, lack of physical activity, too much, so lack of physical activity, less than 27% of the United States adult population gets enough physical activity per week. So that means 73% of people don't move enough. And if you don't move enough, you don't burn calories, you gain weight. When you gain weight, you change your physiology and you get sick. And we're going to talk about some of those in a minute. Too little sleep. The average person sleeps 6.5 hours a day. We need 8. If we don't sleep enough, it changes our appetite hormones. And when you get up, you're going to overeat. And if you overeat the wrong things, simple carbohydrates, then you eat more. So lack of sleep creates overweightness and obesity. Stress, creates a massive amount of problems. Lack of success mindset, that simply just means we all know if there's an apple and an apple pie on the table, eat the apple, but yet we want to eat the apple pie because it feels good right there in the moment. The success mindset is doing the necessary things to get to the outcome. So we have to figure out how do you break that gap by using neuroscience and behavioral psychology and understanding how we meet consumers to get them to do what they know they're supposed to do, but they just don't want to do it. And then the other part is, again, how do we bring the right information, the right skills, and the right tools so consumers on their terms can actually take action that makes sense for them, that meets them where they're at today, and that will take them down the path. So these are the areas that we have to work on. We know this is a massive problem. It affects our muscles and joints. It affects our brain. It affects our physiology, and it affects our pocketbooks. And so there's a big problem that we definitely have to focus on. When you look at some of these numbers, and the biggest thing I want to talk about here is the lifestyle piece, because over 75% or greater of all of these chronic conditions can be prevented by lifestyle changes. So our genetics only account for 20% of the outcome of your health. And you, through your lifestyle, you can suppress the activation of your genes by having the right lifestyle. So even though you may be predisposed to something because of your genes, that 20%, if you do the right lifestyle modification, you don't have to activate those genes. So that's an incredibly important number. So when you look at this heart disease, 81 million people, it's the #1 killer of men, women, and different ethnicities. Costs $500 billion a year, and it's 90% preventable. Diabetes, 57 million Americans have type 2 diabetes, $175 billion problem, and that's 95% preventable. There was a study recently that looked at if you decrease your calories, increase your physical activity, begin to learn health education, which is basically lifestyle education, there's a 43% drop in your medication in 90 days. 43% drop, just simply by changing a few different things. Cancer, that number is bigger than that now. Mental health is a huge issue. So everybody's sad, stressed, anxiety, depression. 44%. 44 million Americans. And then musculoskeletal pain is really one of the biggest, which right now in this room, 8 out of 10 people sitting in here either have back pain right now or have had back pain in the last 90 days. And it's an enormous problem, and it's costing us $685 billion a year. And a lot of that is because we sit too much, and when we sit too much, we get tight in the front of our hips, we get weak in our glutes and our low back and stomach, and we get up and try to do things, and we get hurt. And it can be fixed by getting physical activity and doing it the right way. So we think then the solution to this is ultimately, how do we connect where people work, live, and play, make it seamless, so don't go and create just a workplace wellness program and that's all we do, and don't try to get to them just at home, but how do we really engage them in what they want to do, where they're at, because they're always on their phones, they have their tablets, they have their computers, so let's make this an interconnected approach. But it has to be assessment driven because we're all selfish and we all want to know about ourselves, and it has to be personalized. Make it targeted for me based on what I want. Give me tools that further personalize it. Make it gamify it so it's fun and you give me intrinsic little rewards along the way. Reward me with this, and then ultimately socially connect me to peers that are like me, that have similar goals, and then connect me to professionals that can help me along the way. So we think that's the integrated solution that has to be mapped out for all these different conditions, whether you're trying to manage a condition, reverse a condition, lose weight, manage your stress, get fit, or perform better by getting into a 5K or something else. And we think that health continuum is going to require all of these interconnected pieces. So just a little bit into ShareCare Fitness, the components for us, we wanted to build a platform that can truly deliver the outcomes that we're looking for, but it has to be evidence-based information, which is why we went to all of those top partners that we've talked about. There's a tremendous amount of information out there, and when you think about weight loss, if you do a search right now, you have no idea if that information is credible or not. So what we try to do with our editorial teams and our advisory boards, we would make sure everything we do is evidence-based, and the first way we do that is start with the top brands. And so we're taking the American Heart Association, who has phenomenal information, but how do you get that directly to the masses? Because a lot of individuals are not going per se to that site to look for this information. So we want to bring that to the forefront. Our intended outcome is very specific. We want to put a dent in individuals getting chronic disease. You saw my last slide. 75% of your risk of getting a chronic condition is what you put in your mouth, how much you're willing to move, how you control your stress, how much you sleep, and do you smoke. That's really when you look at all the research and you break it down, that's what it comes down to. And so if we can get individuals and make it that simple and put a scoreboard that has just that and give them the information, the tools, and the support to get there, we think we can make a dent. Then we want to improve health metrics. Then we want to also definitely work on mental fitness. And as we continue from I can't to I can to improve yourself, then we want to help people improve their overall performance so they can play golf or play with their kids or do whatever they want to do. So it's a whole continuum that we want to drive. Not going to beat this up much more, but the bottom one is, a study recently. This is actually more than that. Greater than 80% of consumers will achieve their goal of weight loss with a coach, whereas 50% of people quit within the first 6 weeks without a coach. They just get overwhelmed. They don't know where to start. They don't know how to progress. Are they doing too much, too little? How many calories should they cut out? It becomes so complicated and convoluted. And then when you're on TV, you hear all these different challenges. We want to put them directly with a coach, the right information, and the tools right away. So when we get into this process, as we said, the first layer is assessment driven. Like I said before, we recently acquired RealAge. It's a phenomenal platform. It's a great test and other tests coming behind that. And what we're doing with RealAge as it begins to integrate fully into ShareCare is we're going to gamify it and create this reward structure, and we're going to have multiple challenges and programs that meet people on whether they want to improve their sleep, improve their stress, get to weight loss, whatever their goal is, we're going to drop them in and give them a very personalized experience starting with the RealAge test. And this is a pretty phenomenal opportunity. The next layer after this slide is supposed to be updated, by the way, but the next layer after you take your test, it's getting the targeted information. And the targeted information we give in the fitness or weight loss side, it comes in, we give 3 tips per week, so it's not too much, and it comes as, there's an exercise tip, there's a nutrition tip, and there's a behavior modification lifestyle tip. Then we have webinars, And then we have live stream or webcasts where individuals can come in, watch experts talking about different topics, and they can ask questions live, and we give them live answers. And then we have personal trainers who then go to the activity wall of these consumers and answer questions as well. So we have an asynchronous opportunity. So we try to use auto-generated, asynchronous, and then a live experience to really engage these coaches with the consumer. And the results have been really amazing. The next layer of our program, so again, the assessment, targeted information, now on personalization tools, we have an incredibly robust exercise and nutrition platform built within ShareCare Fitness. And inside of this platform, we have a meal planner, and you can choose reference meals that we've created based off of the guidelines of the Academy of Nutrition and Dietetics. We allow you to create your own menus based on guidelines that we give you. We allow you to log your food. We have 75,000 foods in our database. Makes it very easy. It's drag and drop. You do it from your phone. We have an incredibly robust exercise engine that was built in partnership with the National Academy of Sports Medicine and the University of North Carolina. There's been several studies on it. It's been published. It's been presented at scientific conferences. That program has 750 pre-created programs for consumers, but it also has the ability for you to personalize that program based on your age, your height, your weight, your activity, your goal. You can create an individual exercise plan, and it's based off of, there's 1,500 male videos and female videos. It tells you exactly how to do it, and you can put it into your calendar to make it very easy. Here's when you do your cardio, here's when you do your strength, here's when you do your flexibility. Makes it very easy, drops to your phone. And again, all of this is completely integrated with your content, your assessment, and your coach. So this is a very robust, very robust platform. And then again, after the next layer of the strategy, after the tools, is the coaching. And we continue. We currently have about 3,000 personal trainers on our site. We have tens of thousands of registered dietitians. We'll continue to add personal trainers as we go here into the weight loss with our partner, National Academy of Sports Medicine. And these individuals, again, they work directly in our challenges, and they work directly with consumers who want to engage with them. So we think that the future for us in this of health, wellness, and fitness as it relates to the overall health outcome is creating a digitally connected ecosystem that empowers the consumer, that enables the provider, that socially connects the two, and it is completely personalized. And then obviously it has to be mobilized. We all are walking around on our smartphones, so we have to make that experience that clear and that robust. So that's where we think the future goes. So with that, I appreciate your time, and I think we're going to have a few minutes for questions if anybody has any. I think there's one question back here. The lights are right in my eyes, so I can't see.
Here you go. My question is, can you comment on your business model? How do you get paid? So far, what is your success story?
Sure.
And then another part of my question is, I noticed that Google is your partner. So my question to you is, if Google is discontinuing Google Health, why would you think that you can do better?
So the first part of the question is, what is our business model? We have knowledge partners, and knowledge partners are the hospital groups and some of the brands that we talked about, like Dove, and they pay us to be a part of the site. And what they have to do, though, is they have to participate in the question and answer. So they have to be a part of the engagement with the audience. And so what will happen for them paying, they get a certain placement in the overall Q&A. But before any brand or knowledge partner, we always have hospitals and subject matter experts that are the first category of answers. So that's one way we get paid. We also get paid by hospitals in their demographic to leverage the platform. And the third way is we're launching a marketplace that will sell direct to consumer programs and coaching with different sets of professionals. So that's that one. The next question about Google Health and our being competitive or thinking we can build something better, we're not even focused on that. We're focused on The last slide that I had there, which is creating a very comprehensive, assessment-driven, targeted information, support, all connected socially. So we think that's a pretty unique opportunity, and we want to bring anybody who wants to participate on ShareCare into the ShareCare arena, because again, it's a social health network, and ShareCare, it's not ShareCare's voice, it's ShareCare's ecosystem that's allowing everybody else to have their voice. Try to stand those lights right in my eye, sorry.
Hi, out of curiosity, how is pharmaceutical industry relating to what you're doing? Do you have interest? What's their vision of this? Do they talk to you?
Yes, so we actually, that is one of our, part of our financial model, is we have pharma partners that engage in the audience as well. So they become knowledge partners. We have several pharma partners right now.
Could you talk a little more about your traffic acquisition? You mentioned long tail search, 4 or 5 word queries coming from Google. Dr. Oz on TV, of course, is so effective driving people to his site and ShareCare. How's that balance working out?
Rich, you want to assist on that one? So my partner, Rich Benchey, by the way, he's an executive vice president at ShareCare, and he was the previous president of Real Age, and he's worked very closely with Dr. Oz, so I'm going to have him kind of work with me on some of these.
So for traffic on this, we have basically a third. We do partner with Dr. Oz on television show, great spokesperson for ShareCare, great driver of traffic. So a third of our audience on ShareCare.com is coming from Dr. Oz, which is fantastic for us. A third is coming from the long tail search directly, which is fantastic because that's the organic search. We're meeting people from how they're currently seeking health information. They're typing in questions on Google, they're not going to a branded site to start their search. So we're quite optimized because of our question and answer format to bring in people directly from their Google search. ShareCare often ranks #1 on long tail 4-word plus answers. And then the last third is through our partners. So when we do programs like we did Transformation Nation, Weight Watchers participated as the sponsor of it. They're also driving their audience into it, and we do that with all of our partners, whether it's a hospital partner, a sponsoring partner, our fitness partners. So it's really a third for our traffic.
Before I hand this off to someone, I have a quick question. Rewards. So you talked about rewards as incentive for long-term engagement, et cetera. What do you find are like the most effective rewards? Are we talking monetary? What are the most effective rewards, and how are you kind of integrating that?
Sure. In the short term, it's monetary creates the drive and the engagement, but then long term, it's the intrinsic side as well. So we create badging scenarios. We create the opportunity for individuals to get micro rewarded. So if you open up a video, if you read an article, if you take an action, they get points, and then those points can be redeemed for personal items that they would choose. So it's a combination up front of a bigger reward, like for example, in Transformation Nation, it was $1 million reward, and then to keep people flowing in the program, it's micro rewards throughout.
Are you considering any brand extension products or initiatives with ShareCare?
We are right now. We're in strategic discussions on the branding side. The challenge is because we have this social health network we want everybody to be a part of. So we want to be very thoughtful of our brand and where we take the brand and what it's associated with. But we're definitely in thoughts of that right now, or discussions on that.
Can you suggest some of the things you're looking at, or is it proprietary?
It's not proprietary, it's just too early.
You have a picture of mobile devices, and the majority of us have all our mobile devices here, iPads, tablets, etc. Are you, or I should say, ShareCare planning on hooking up any devices, any applications in health, anything of that nature to expand your reach?
Absolutely, and that's a next big phase for us in the end of the third quarter to the fourth quarter. So that's definitely the next piece, the next phase in the game. So anybody that has devices here that's interested, we certainly want to talk with you.
Yes, how do you manage the inherent contradiction between the commercialization of a health-oriented website versus branding and populating or rewarding people who pay you versus people that don't, and maintaining the kind of trust you need for consumers to want to continue to use the site?
Yeah, it's a great question, and it's actually a very complicated question to answer. It's a fine line that we have to walk. We always stay focused on creating digital trust and bringing top brands in and making sure that we give consumers what they're looking for without trying to sell them things. So it's a very fine line, and we're continuing to learn as we go and as we evolve. But that is the driver for us, and the bumper zones to make sure that we're maintaining digital trust with our consumers and our partners.
How do you compare to other Q&A sites like Avo and HealthTap? And do you consider them competitors?
Well, it's interesting, and Jill and I were actually having that conversation a little bit this morning, and we like to consider ourselves collaborators versus competitors, and obviously anybody who's trying to get consumers to their site and have monetization models, then that's always competition per se, but we're more interested in collaboration, and we're more interested in can we work together to ultimately get to these health outcomes, because ultimately that is what our site is. It's an integrated, collaborative social health network.
Any final questions? I think I have one. Okay, thank you.
So as a consumer, how's my data stored and used by your system?
So I'm not the technical person. Rich, do you want to give an answer to that, because you have some experience based on what you've done at Real Age?
That's right, that's our fitness program for the day. So right, we protect the privacy of our users. We use the data to personalize their experience. So that's how the data is used. So when people took the Ultimate Health Quiz as part of the Transformation Nation, it was all to give them guided experience based on where they're starting from. The data is always protected. It's never shared with any of our partners. Pharma companies don't have access to the data or anything like that. So, and again, I'm not a technologist either, so I don't know all the security lingo and all that, but privacy is protected. It's used for personalization.
That's great.
Thank you very much.